When most of us think of fat, especially this time of the year, we only want to lose it and get into shape. But what if you could use it to get the shape you want? Well, Dr. Bill Johnson of Innovations Medical is here to show and tell us all about the beauty of fat transfer. It's a hot topic. We've been talking about it. Welcome back, Dr. J.
Good morning.
All right, fat transfer. We're making use of our own fat. How does this work?
Formally, it's called autologous fat transfer or autologous fat transplant, meaning your own fat, your own tissue. And it's just the perfect volume filler because it's your own fat, it's you, so there's no chance of a reaction or an adverse problem. It looks and feels natural because it is natural. Using modern techniques, up to 90% of the fat survives, so it's really becoming very reliable as a filler.
That's a high number now, 90%.
And when you really look at it by volume, it's inexpensive. If anything over about a tablespoon of Restylane or Juvederm fat's much cheaper.
Okay, so better results, and it's more natural. It's actually coming
and
from
long-lasting.
From your own body and long-lasting. So where do we commonly use fat as a filler?
Well, facial fat transfer is really maturing.
Okay.
And I just came back from the American Academy of Cosmetic Surgery, and everyone that was talking about facial rejuvenation from all levels is using fat as part of that. So facial fat has become mainstream, and really very little work is being done anymore without doing some fat on the face.
Okay, and that's really where you see those great dramatic results like we're seeing here. So besides the face, there's other areas that we can use to add volume.
Yeah, breast is really coming on. If you went back 5 or 6 years ago, it was only 7 years ago that the American Society of Plastic Surgery took their recommendations away from fat transfer to the breast. They now say it's a acceptable procedure, but now you're seeing fat transfer increase in the numbers. You're also starting to see fat added to implants, using both to improve the texture and the feel.
Okay.
And you're also seeing fat transfer used a lot in breast reconstruction. So more and more fat transfer is being used as a nice alternative to implants.
And some people are not good candidates for this type of procedure, but that's what the consultation process is
That's what the
about.
consultation's for. We have to know the right people, and that's a time that they're going to get to meet with me and decide, is this the right technique for them.
Okay. What's the most popular area, would you say, for fat transfer?
Well, in our practice, the buttocks or Brazilian butt lift is the most popular. Buttock implants have never really caught on too much because most people never lose sensation that they're sitting on a pillow. And when you do it with fat, there is no change in sensation. So you get a nice feel. It's natural both to the person that is sitting on it, and to people that look and see it. So it's a very natural filler and works very nicely. And we can change the shape, lift, just add size.
You are always constantly going to medical conferences and alike, and you learn so much from these different conferences. And I know a big innovation lately is the fat cell survival and things that you can do to really enhance it.
Recently adding platelet-rich plasma, which is a substance that we get from your own blood, lacing it into the fat definitely increases survival. Increasing studies are showing that. We're also starting to see more and more information on what's called stem cell enrichment. There already are stem cells in the fat we're transferring, but we can actually enrich that and increase that number, and that not only enhances cell survival, but it appears to improve the texture and appearance of the skin overlying.
There's lots of good innovations here, and we can find out more by visiting the website and watching our Dr. J videos. Here's where you find that information, innovationsmedical.com, or view those Dr. J off-air segments. They're on his website and also on YouTube. And if you want to set up that free consultation, call the Dallas office, 214-420-7970. And in Fort Worth, call 817-7